Good morning, my classmates. My name is Ed Globa, and I'm here again to talk about speech 2, which is about my taking blood pressure, introducing to you a machine that all of us have seen in our homes or in doctor's appointments that we use to take our blood pressure. And the machines I'm going to introduce, they come in different kinds, but I have 3 that all of us, I'm sure we have seen them. The first machine, or rather blood pressure tool, is the manual one. This one, a cuff, and that's by gynometer. Can't even say that name, I'm sorry. And it comes together with a stethoscope. The doctors, the nurses love this because this is the most accurate one. This one. That's why the doctors, the nurses, when they come to the room, when you go to these appointments, they always have this one. This is the most important one. Then we have the automatic ones. They come in different shapes, sizes, but I'm sure all of us have seen this one. This is a small one, goes on your wrist. It's automatic, same screen like the other one I'm about to introduce, but this goes on your wrist. It's very easy, simple, and just turn it on. It will do its thing so long as you cuff it right. And I'll talk about that in a few minutes. Then, the third machine that I want to introduce is this one, the automatic one. Just like the little one, but it's much bigger. And this one goes on your arm. The machine itself is battery powered, which is good, reliable. Then the cuff. They come in different sizes depending on your size. We have those for children, and depending on your size, they come different sizes. And this one is very simple, what I'm going to talk about. Once you have it, you plug it in, the cuff plug into the machine, and then you have to choose the right cuff. That's very, very important. Choosing the right cuff will give you either a higher reading or a lower reading if you don't choose the right cuff. Number 2, also make sure that you cuff this right on your arm, right at the level of the heart. You cuff it right, and this part that you see, this where the tube joined into the cuff, needs to align with your vein, with your arteries, right here, because this is where the machine will sense your heartbeats. Once you align that, make sure that it's cuffed right, tight enough. If it's too loose, it will give you an error or a lower reading, actually a higher reading. If it's too tight, it will give you a lower reading. So it will give you an error, a not accurate reading. So before we go further with that, let's have a quick talk about what is a good blood pressure reading. And the American Heart Association gives these numbers have changed a lot. There are places you'll be told different numbers, but this is the American Heart Association number. So the systolic number, which is the higher number, if it's less than 120, you are in good state, and the lower number should be less than 80. But if it's between 120 and 129, it's elevated, what they call elevated. And then anything that is above, the higher number is above 180, the systolic number. And then the other one is above, the small number is above 130. That's what we call a hypertensive state. That's a crisis. You need to call 911 and go to the hospital. Those numbers can easily get a lot of complications, including a heart attack. So It's good to keep on these numbers. As they say, hypertension is a silent killer. You don't know if you have it unless it leads to that crisis. Sometimes it can be too late. So I can't reinforce enough to know these numbers and make sure they're within range. Having said that, now is how to take good blood pressure. And I'm sure all of us have gone to the doctors and we see, and mostly now they will, when we take them at home, we might not maybe follow the right way, and we could get an inaccurate reading. So they recommend that there's a way you have to sit. First of all, choose a right chair, good chair. I have a small chart here to show you how to sit. As you can see, the lady in the drawing, in the picture, all your legs should be seated flat on the table. You sit with the legs flat. Then your arm should be at heart level. Make sure that you relax, breathe normal, and sit upright. Just as she's seated right there. Make sure that you are not talking, because if you talk, your heart's gonna rest and then gonna give you a wrong reading. Stop talking and then put on your cuff. And as I had shown, if you look at her cuff is exactly the way I had explained. With that, where the pipe joins the cuff, right there by your artery and your big vein, and then turn on the machine. Once you turn on the machine, it will do its thing. It will read and give you 3 numbers. The first number will be the top, or be at the top, which is the systolic number, and that one, which I said, it should be less than 120, and you're good. Anything above 180, that's a hypertensive crisis. Then the middle number, which is normally called the lower number, which is called diastolic. That lower number should be less than 80. And that number if it's more than 130, again, you are tending into a hypertensive crisis and you need to go be checked. Then it will give you another number at the bottom, which is your pulse. It will give you your pulse reading at the same time. So if those numbers range within the range that I had just shown you before, then you're good. As they say, hypertension is a global crisis and it's a silent killer. Most people don't know that they have it. It's not like if you have a cough or a flu, you cough or you feel weak. This one has no symptoms until when it's too late. So it's always recommended to check your blood pressure, especially if you suspect that it could be high, or people that have other comorbidities like diabetes. It's always good to check your blood pressure and keep it in the level where it is, so that to avoid future complications that come with that. Having said that, I will conclude by saying thank you so much for watching my video, and I hope you have learned something about taking good blood pressure. Thank you so much, and good luck in the rest of the class.